Hi everyone, and welcome to week 8. It is hard to believe this is our last week together. This week we'll be talking about substance abuse treatment and prevention, which go along with chapters 15 and 16 in your textbook. These are this week's objectives. They are also listed in Blackboard. The items that are due this week include your problem drinking assignment, chapter 15 Global Health Watch quiz, DARE Wiki, Chapter 16 quiz, your drug research paper, and of course the discussion board. For the problem drinking assignment, the purpose of this assignment is to help you understand two different options for treating alcohol treatment. One is moderation management, and the other is Alcoholics Anonymous. I have provided two websites in this assignment for you to use to research the two programs for alcohol abusers. What you'll be turning in is a chart comparing the two models, Alcoholics Anonymous and Moderation Management. You can organize the information any way you'd like. You can do a Venn diagram or a table, but create a heading for each topic you're comparing, contrasting, and explain each topic. For example, if you're going to be comparing costs, then the heading should say costs, and then under Alcoholics Anonymous, it will say free. Under moderation management, you'll have to look that up to see what the costs are associated with it. Or you could write abstinence, right? So for Alcoholics Anonymous, it is a program that suggests that people remain abstinent from alcohol, and moderation management you will look up to see what their guidelines are for alcohol. The next assignment is DARE. It's a wiki, and the purpose is to gain a better understanding of the DARE program. And then also, if you have gone through DARE, reflect on your own experience of going through DARE. What you will do is go to the website dare.org and go to the Education tab. Choose one of those programs to review. You can review either elementary, middle school, or high school. And then review the website links containing materials related to the effectiveness of DARE. And then also review your textbook's explanation of the DARE program. And then in the what, here's what you'll be answering. Did you or someone you know participate in DARE? What was your experience? Do you think it was effective? Do you feel there's enough evidence to demonstrate that DARE is effective? And then defend your answer. Read your textbook's explanation of the DARE program. It states that DARE is ineffective as a prevention program. Do you agree with that statement? Why or why not? And then lastly, how would you judge the effectiveness of a prevention program? And for this, I mean in general. What would you look for in any prevention program? Would you look for a reduction in drug use rates? Would you look for more responsible drug using behavior? Would you look for a delay in drug use or starting in an older age? So think about how you would like to see a prevention program rated. And then lastly, you have not lastly, but the other assignment we'll talk about is your drug research paper. Some things to review before you hand it in, these are just some common mistakes I see students do, is that their paper is short. Your paper should be at least 4 pages, double-spaced, 12 font, not including title page and reference page. So the body of the text should be at least 4 pages. Remember to cite your sources within your document and at the end, and you're using APA for this paper. Make sure you have a reference page in APA format, that you have at least 5 references, 4 are from peer-reviewed journal articles, and that you review the rubric to make sure that you have followed all the directions for this paper. As you can see, this paper is worth 50 points. It's a significant part of your grade. All right, this will bring us to our lecture for this week, so substance abuse treatment. Think about these questions. Should drug abusers receive treatment or incarceration? Do we view drug abusers as deviant or are they ill? Is addiction a disease? Can addiction be cured? Almost 22 million Americans need substance abuse treatment. Of that, only 10% actually receive treatment. The 5 top areas for receiving treatment are for alcohol, opiates, marijuana and hashish, cocaine, methamphetamines, and amphetamines. When we look at treatment, you have to consider the underlying causes of drug abuse. So what causes drug abuse? Most professionals in the field believe that treatment must address these underlying causes of drug abuse. So what were the causes? What started the drug abuse behavior? And some of those factors include poverty, inadequate health care, hunger, ethnic discrimination, and having an inefficient educational system. In one study of prison inmates who used heroin, methadone, cocaine, PCP, or LSD, half of them did not use those substances until after they were arrested. So what does that mean? That people start using drugs in prison, and these are serious drugs. That's a big problem. Here's this idea of drug courts in the United States. So as you can imagine, there is a strong relationship between substance abuse and criminal behavior. The purpose of drug courts is to reduce crime by offering drug treatment programs to be completed instead of going to prison. And what they found is when they offer these programs, it's cost saving, so it's cheaper to send someone to a drug treatment program. And it also reduces recidivism rates, meaning they are less likely to recommit a crime and go back into the court system. So who is the typical drug abuser? Male, white, unemployed. Some of them have not completed a high school or a GED program. They have mental health problems, and they are more likely to abuse more than one drug. It's important to remember that substance abuse is a chronic disease, a long-term disease. There are no quick fixes. Addiction is heritable, meaning if a parent is addicted, that the children have a higher likelihood or chance or risk of getting an addiction. It's influenced by environmental factors. It responds differently to treatment options. Not one treatment is effective for all. Relapse may occur even in the best circumstances. And some people may go into spontaneous remission. When we look at the principles of an effective treatment program, here is what the book suggests, is that people need to have quick access to treatment. So if I decide today that I need to enter a drug treatment program, I need to have access to go into that treatment program today. Staying in treatment long enough is critical. Medications are often an important part of treatment. Treatment plans must be reviewed often, and they should be modified to fit the patient's changing needs. Treatment should also address other mental disorders. Medically assisted detoxification is only the first state of treatment. So once a person gets off of the drug, treatment still needs to continue. And then drug use during treatment must be monitored if there are other drugs in the process. And by this, I don't necessarily mean the substance of abuse, but it could be medication needed to help assist with detoxification or medication to assist with treatment. Here are the components of a comprehensive drug abuse treatment program. And as you can see, there are a lot of components here. So you need to look at the treatment plan, the pharmacotherapy, continuing care, clinical and case management, behavioral therapy, substance use monitoring, self-help and peer groups, and then all of those wraparound services, including child care services, family services, housing, transportation, and so forth. As such, there are 3 main categories of treatment programs: self-help groups, inpatients, and outpatients. Inpatient treatment programs are hospital-based or licensed treatment facility. They can be short-term or long-term, but they offer 24-hour structured and intensive care. They tend to be very expensive, and they fall into 2 categories, either therapeutic communities or short-term residential. Many of these centers advertise really high success rates, but in looking at those success rates, it's important to question them. So how is success defined? Is it defined that 100% of people who leave that treatment facility are drug-free? Okay, but then what happens 6 months after the treatment program? A year after the treatment program? The other category is outpatient treatment, and this tends to be the most common form. It's readily available, less disruptive, meaning I don't have to check into a facility. I don't have to worry who's going to take care of my kids, who's just going to pay the house bills. It's less expensive and less stigmatizing. This can range anywhere from counseling centers to halfway houses to community centers. And they can meet up to 3 times a week for 2 to 3 hours per session. It just depends on the facility where a person is attending. We look at the different types of therapy for drug treatment. There are many different types, and we'll just go over a few. We have cognitive behavioral therapy, which is short-term, goal-oriented psychotherapy. And the purpose is to help increase a person's coping skills. Then there's family therapy, which addresses family conflict, and this is offered to parents who have a child who is abusing drugs, and it tends to be most effective for this type of situation. Then there's motivational enhancement therapy, MET, and this is to help change internal motivations. This technique uses motivational interviewing, and it's most effective when trying to help patients realize they need treatment. So in the early forms of recognizing that there is a problem. Another option is contingency management. This really focuses on rewarding positive behavior. It's also known as incentive-based intervention. And this type of program offers incentives for remaining drug-free. As I mentioned, there's also self-help groups. Examples are Alcoholics Anonymous, Eating Disorder Anonymous, Narcotics Anonymous. Alcoholics Anonymous AA is the largest self-help group in the United States. It offers fellowship and support. It is cost-effective because it's free, and it may help people in maintaining their drug-free status. Now we need to look at relapse rates. As I mentioned earlier, drug addiction is a chronic disease. As such, it should be treated as a chronic disease. What I'd like you to look at here is this chart or table that shows a comparison of treatment for hypertension, which is high blood pressure, and addiction treatment. What you'll notice here is that these numbers are the same. We look at relapse rates, so here's the pre-treatment rates, during treatment, and then post-treatment. So if relapse rates are the same for disease and drug addiction, why do we tend to blame people who are addicted to drugs when they relapse? The next topic we're going to talk about is drug prevention, which correlates with Chapter 16 in your textbook. Again, when we look at effectiveness of prevention programs, it's hard to assess how effective a prevention program is. First of all, there's usually an absence of a control group, so you don't have a group that goes through the prevention program and then a group that doesn't go through the prevention program to compare outcomes. There's often poor data collection. The groups that are being looked at are too small. The statistics being used to determine the effectiveness are inappropriate. And there's often a lack of follow-up to determine how long any change in drug use persisted. We look at school-based programs. There are 5 essential criteria. One is that there are adequate hours of curricula over at least 3 years, that there's a peer involvement component. There should be an emphasis on social influences, life skills, and peer resistance. There should be a change in perceived norms, and there needs to be involvement of parents, peers, and the community in helping change those norms. We look at the goals of drug prevention, and the questions that must be asked are the following. What does prevention mean? Does it mean I've never used drugs? I never used drugs after the program? Does it mean I delayed the use of drugs? So I was older when I tried drugs? Does it mean I use drugs more responsibly? Should the goals be different for a person who has never used drugs than for a person who uses drugs occasionally? Should the goals be defined as a delay in the onset of drug use, the complete elimination of drug use, or a significant decline in drug use? When we look at the drug prevention programs, many of them do not establish clear goals. What are they trying to achieve? So here are just some examples of goals of drug prevention programs. To prevent the individual from beginning drug use. To minimize the risk of drugs to a user. To reduce the risk of drug use to society. To prevent drug dependency. To teach responsible drug use. To stop drug use after patterns have been established. And to delay the onset of drug use. Now we'll look at the levels of drug prevention. There are 3 levels: primary, secondary, and tertiary. Primary prevention, the goal is to reach people before they start using alcohol, tobacco, or other drugs. It should be initiated at a young age because you're trying to catch people before they have ever tried a drug. And this includes drug education, mass media campaigns, community-oriented programs, drug testing, and legislation or laws. Secondary prevention attempts to minimize potential damage resulting from drug use by targeting people who've had experience with drugs. This is considered an early intervention stage. We're looking for people who just started using drugs. It's not geared towards those who have a drug addiction problem. The goal is to alter drug-related attitudes and behaviors, to provide alternatives to drug use, and promote a healthy lifestyle and physical fitness. The last part of prevention is tertiary prevention. Now, this one is geared towards heavy drug users and those whose patterns of drug use are already established. This is also referred to as drug treatments and is beyond the scope of education. Education alone will not help with tertiary prevention. This concludes our PowerPoint for this week. Have a wonderful week, and of course, let me know if you have any questions or concerns about your upcoming paper.